Yep.
So essentially, if we've got exposure to the pulp cavity, unless you do root canal, the tooth's got to come out. This is a fourth upper premolar or carnassial tooth. It's a very complex tooth with very complicated roots. And it's in a pet's best interest with an old fracture like this, and the fact that a piece of the tooth is missing here, to take the tooth out. We'll do a gum flap and remove the tooth, and they get a much better recovery. So regrettably, we can't save this tooth as much as an owner would like to, but this pet will be much better off. This will be painful, and by taking the tooth out 3 days later, there's complete cure.
So lift it up.
Yeah, that would be great. So the difficulties with closing something like that, Shereni? Not much gum to work with?
There's not much gum to work with. The gum was tearing because we had to do a flap and it was quite damaged already. And
but it's closed quite nicely. But looks much better.
Looking much better.
So letting you know some of the things that happen when a dental procedure is happening. This little guy is under general anaesthetic. You can actually see we're scaling the teeth using an ultrasonic scaler. Pretty much the sound's the same as you'd sound on your teeth. You can see the vet's got a loop, so there's bright light in the mouth. We use very similar equipment to what we would use in a normal human dental. So I'll show you the machine. You can actually see the handpiece. That's a fast handpiece for cutting the roots, a polisher, a scaler, a flusher. You can see some of the dental equipment we have, pretty similar to what you might have at your own dentist. Different extraction forceps, etc., etc. Different root elevators. You can see some of the teeth that have been taken out here. Really big roots. What I also want to show you behind the scenes that no one ever sees is the incredible monitoring we have. I'll try to share. This is the monitoring of this patient. What's his name, Mel? So Joanna. So if the top one's an ECG, because we're scaling and polishing, the ECG is not as clearly as it might always be. You can actually see that the
You just turn the dog,
the end tidal CO2 is 35. That's the amount of carbon dioxide in the expired air. You can see we're recording blood pressure. You can also see there's a drip running, 75 mils per hour. We've got a pulse ox as well, just to double check. So the SpO2 is 100%, which is absolutely perfect. And the pulse is about 70, which is fantastic. As you can see, our patient, you can kind of see, is covered with a blanket to keep warm. And he's also got a heat mat under him.
And one on top at the moment as well.
One on top. So you can see the setup is really good. There's an anesthetic. You can see there's a veterinary dentist. There's an anesthetic nurse. And we often have other staff assisting. So there's a lot of stuff that goes on behind the scenes that you don't know. What I'll show you as well, although it's not connected at the moment, the computer in the dental room is this is a dental x-ray computer only. This is the little, this is actually the thing we put in the mouth to take x-rays, and we get incredibly good dental x-rays. Maybe I'll switch on, I'll show you some of the dental x-rays we get. So we can really see, should that tooth be taken out? Can it be filled or saved? Because sometimes we try and save the teeth. So again, you're watching our dentist at work. You're seeing a pet under anesthesia, so just be aware of that.
This is a great after.
Right.
You see them? We're just waiting for Puppy to wake up, aren't we, Boo?
So this is after a dental procedure.
We're starting to come to.
Our little pet is starting to wake up. You can see there's still a tube in. The tube's almost ready to come out. When you start coming with anesthetic, the eyes start moving. That shows you in a lighter plane of anesthetic. It's not a neurological problem. And we know we're almost ready to take the tube out or extubate. You can see that he's looked after by our nurse Mel. Just looking after him in the most loving, caring way. And as we reinforced, a nice warm blanket covering him. There's a heat mat underneath. You can still see that his oxygen is 99%, his SpO2, his pulse is 65, so he's relaxed and oxygenating beautifully. We've still got a drip running, and everyone's very calm. Our vet Shereni, who's done an amazing job, is also relaxed because we know we've done such a good job. We're all happy. You know, if you actually have a look at that little syringe there with a 31 gauge needle, that's local anesthetic. So just like your dentist gives you anesthetic, we use local anesthetic to numb the pain. So when this little guy wakes up, which is happening right now, surrounded by 3 of us in a really nice environment, it's going to be peaceful. So Mel's going to take the tube out. First we've taken out, this little thing that's come out. Mel, you can't take out his swallowing. This little thing we've just taken out his throat.
There you go.
Focus in a second. Hello, Mel.
You're back with us. This is Boo.
So you can see how they come out of anesthesia. It's calm, it's peaceful, it's beautiful. He's had some ketamine, he's had a little bit of butorphanol. The anesthetic gas will now go out, and over the next hour or 2 he should recover really well.
Boo has the nicest donor. Was panicking because we were 20 minutes late with dinner last night, so he was messaging around at 10 o'clock at night on our Facebook page.
And you can see, you know, being a veterinary clinic, we do dentistry nearly every day, and doing dentals is really rewarding and really nice. You want to get roots out completely, so it wasn't really meant for the video, but you can just see complete roots. One of the teeth we've taken out is the 4th premolar carnassial, which is really big, but the aim of this is to see a peaceful, gentle recovery in a warm, nice environment. And now he's going to go into a heated cage, and you know, we don't really even need, we don't have to really follow much because everything went very, very well.